Bismillah.
Good afternoon. Thank you, MegaGen and MegaMind, for giving me such opportunity to be here. Let me first introduce myself. My name is Hamdy from Alexandria University. I'm Assistant Lecturer of Odontology and Oral Medicine there. And my title for today would be Insights into GBR Principles Around Dental Implants. As we know from the word insights, is something usually related to rethinking, revisiting an established protocol. And my lecture today would be about insights directed to our mind, not to our hands or skills. So it's convenient with MegaMind. So let's start by the insights agenda. We will talk about the contour augmentation. Can GBR alone do the job? Then we will direct it to limited GBR concept. Then we will finalize by proposing a criteria, which is an update for past criteria for successful GBR procedure. So let's start first by the indication of the purposes for doing GBR, as we know that we usually do it from the literature to replace lost bone or enhance facial contour. And of course, the first indication is something logical, because we can use it to restore bone before implant placement, as we see in the first case, maybe during implant placement, as we see in the second case, or maybe after implant placement. However, the second indication for me was a little bit controversial, because I actually didn't find any picture after GBR procedure that has enhanced facial contour. Even I did a huge augmentation of GBR procedure underlining these collapsed soft tissue. And to figure out why, let's take a closer look for these following two cases. As you could hear, we started with this collapsed facial contour, and then we open a flap and place our implants. After that, we found that we are ready to make a huge GBR procedure. As you could see, huge GBR procedure was done. Then, to finalize the case, we just found that we still had this collapsed tissue. And the reason why, because we usually intended to use what we call it matrix suture in order to close flaps after doing GBR procedure. And these matrix sutures usually tend to get your flap displaced coronally, making your augmented part apical to the area you needed. On the other hand, if you are doing a soft tissue graft, as you could see here on the left, we just closed our flap in a primary closure, and then we will find that our augmented area is exactly at the area we needed. This is consistent with the literature. We found in the literature last July, this paper comparing between GBR procedure and soft tissue in regards to facial enhancing. As you could see, that soft tissue is doing a good job, while in the contrast, the GBR actually not doing a good job, even in comparison with negative control. And by connecting such paper with the results of the literatures we found from 2016, we found that most of results are favoring placing soft tissue graft rather than doing GBR in order to enhance your facial contour. So let's rephrase again the indication for the GBR. Yes, we do it for replacing lost bone, but in regards to enhancing the facial contour, we should do two things. One of them is just for a combining soft tissue graft after or during GBR procedure. One of them is doing some flap soft tissue management while doing this. I will show an examples for every case. Now we can have this case with a facial collapsed contour, and we should, after that, go for soft tissue grafting. Like you see here, we go for subepithelial connective tissue graft. After that, we will find the follow-up, even before we remove the sutures, we can get a huge augmented buccal region, as you could see here. And here's the same restoration. 1 week follow-up, you could see that we had enhanced soft tissue contour, and you could see here following 5 weeks, with the same restoration, we have enhancing this contour. The other situation I recommend that you can use a flap management protocol while opening a flap in the second stage. As you could see, one of the most common techniques for doing this is modified rolling technique. As you could see in the video, we start with our blade not directly to the bone and then getting in the palatal direction. After that, you will get this pedicle connective tissue graft, start rolling it, and close your flap. Now you enhance it a soft tissue contour. So, to sum up this inside, we know that GBR is not indicated alone for enhancing the soft tissue. So you don't need to make GBR procedure to enhance your soft tissue. Okay, so what we make GBR for is just for augmenting the lost bone. That will direct us to the limited GBR concept. We only augment what we really need. No need to over-augment, no need to over-contour. And I will show you this technique. In this case, the patient came complaining of missed both tensils and need to be replaced. He have been extracting these teeth since 2 months. After we open a flap, we find this. One of those centrals have completely resolved buccal plate of bone, while the other central still have this buccal plate of bone. So, as we know from insight number 1, no need to over-veneering or over-contouring the existing buccal plate of bone. So we only augment this area. We just augment the area that we really need. So we are trying now to regain again the buccal plate of bone by only doing a GBR procedure confined or limited to this area. You can notice also that we are not intending to take our membrane to the palatal side because we didn't need any bone here in this area because this is the area of the connection. We're just mimicking the other labial plate of bone. And as you could see here is the follow-up. You could see that we have this the augmented area, and on the other side we could see this area with present buccal plate of bone with only filling the jumping gap with xenograft. And here is the crowns after insertion. Here is 1 year follow-up. You could see that the papilla start to go because we have a stable GBR procedure. So we mean that we already gonna to augment only what we really need, no over-treatment, no extra material, no waste for time. But to make sure that you are doing this, you should be confident enough that you are able to augment this limited area. And here is a proposed protocol, which is an update for past criteria. As we know from the literature, past criteria was done by Dr. Wang, and he suggested that primary closure, angiogenesis, space creation, and stability are important criteria to have a successful GBR. But regarding our practicing, while using this closure, we usually use a lot of suture techniques, such as this stress breaking sutures, rather than using something like interrupted suture that will make your forces and your stress latent in the flap while the patient starts to talk, okay, making this bone start to diminish in size. So now we are shifted from primary closure to optimum closure. And then we put the other criteria from Dr. Wang, and then we added 2 important criteria. One of them is material selection, and the other is, huge flap release. Now you could see the letter of my name, just a coincidence. But actually what I'm doing on this, we're working on this literature review. You can see that we start with Dr. Abrar writing a literature review, trying to get all of these criteria up to date in literature till now. Finally, I will finish my presentation taking this case and applying our proposed criteria on it to find out if these criteria start to work well or not. So as you see, this patient came to replace lower anterior teeth. So we start by flap design. As you could see here, we open 2 vertical incisions, not to take our flap to this predominantly involved teeth. And then, as you could see, we have a very thin crystal bone. So we start to make a plateauing. This plateauing will allow us to facilitate the implant drilling. Then we started here, the first part of our proposed criteria, the huge flap release. We started by modified periosteal slitting, as we know that we start first by sharp dissection using the blade, and then we go with blunt dissection, separating the mucosal tissue from the periosteum. After that, we started our drilling. As you could see, we are collecting bone, autogenous bone, using a spiral drill from MegaMind. After we place the implant, we realized that we need to augment this area. So we start our augmentation using semi-rigid membrane like PTFE membrane and start to stabilize this membrane using bone tacks from the lingual side. As you could see, we just come back again to the material selection criteria. As you could see, we only use autogenous bone coming from the drills at the first layer, and then we start to overlay another layer by allograft material, and we only augment these areas of the implant only, nothing in between the implants. Back again to limited GBR concept. And then we closed this chamber. We closed the PTFE membrane using also tissue tacks, as you could see, creating a blood clot, which is stable in this area. And here you could see the space created by PTFE membrane. And then we finalized using optimum closure criteria. We close using 3 types of protocol. Number 1, which is stress breaking suture. Here we used apical horizontal mattress, and another closure suture for the crystal part using double barrel closure suture, and we also use simple interrupted suture for the vertical incisions. 4 months later, as you could see here is the results of our grafting protocol. So we found that we augmented the area in between the implant, even we didn't place any bone graft material there, thanks to the closed chamber that we created using the criteria. So as you see, we started with this case, and then we just placed bone material only on the implant surface, nothing in between implants, and after that we ended up like this picture. Also on the other implant, we created 2 millimeter buccal to the implant, which got the implant against absorption. 2 weeks later, we started our fully digital model-less workflow, starting by healing abutment, putting multi-unit abutment, and taking a digital impression and designing a wax up, and then finalizing the restoration and FB3 restoration, screw retain restoration based on multi-unit abutment. So here's the final restoration. And here's the take-home insight. This is the tissue enhancement procedure, usually show better results than GBR in contour augmentation and enhancing the emergence profile. Number 2, just augment what we really need to augment, no over-treatment, no extra material, no waste for time. And number 3, paying attention to every step in GBR procedure will result in successful, teachable, repeatable outcome. Thank you, and I hope this presentation was engaging and fun.